Alginate impression technique. The first step is to make sure you have the right size tray. Also, positioning the patient is important. I always have the patient laid back. Most people think that if the patient's laid back, it's going to be more likely that the impression material is going to cause them to choke or gag. It's actually the opposite. If you imagine the patient's throat is right here, and when we take the impression material is going to flow with gravity down this way towards the back of their mouth, not down their throat. If I had the patient sitting up, then you can see that when we take the impression, there's more of a chance that the material can flow down the patient's throat and cause an issue. So I always have the patient laid back, fully reclined. The other reason why we do that is so that we can see. So tip your head back for me, open wide. With the patient laid back, tip your head back even more. Just by leaning forward, I can look and see all the way to the back of the soft palate, or the back of the hard palate, behind the second molars. I can see where I need this impression tray to fit, and then once I fill the impression tray with the impression material, then I can see where the impression material is flowing. So in order to check the fit, you're going to retract the cheek with one hand. With the opposite hand, you grab the tray and use the tray to retract the opposite cheek. That allows you to insert the tray in the patient's mouth. And right away, I can see that this tray is a little too narrow. So we're going to try a larger tray. This was a medium. Try size large. Same thing, retract with one hand, use the tray to retract with the other hand, and we still need a little larger tray. So, pause it.